So we have some learning objectives, and we're going to use the different learning objectives that we have to kind of break up things and kind of go back and forth. We're hoping that we can get through questions at the end of the presentation. We have a lot to cover, and we know that you guys are going to have some questions because our experience might be a little bit different than your experience. We're not experts. I don't know that there is a coronavirus expert unless maybe Dr. Fauci, but that's not us. But we're living through this with you, and as technicians and on the floor and talking to technicians, we just wanted to come at this from a technician point of view. So we hope that you will, you know, put some things into chat that we can talk about at the end of the presentation. So we're going to kind of begin with where we're at now, and then Elaine's going to take over.
Yeah, then we're going to look at you guys, what you're doing on the floor, what are the pain points that technicians are experiencing, and solutions to that.
Yeah, and then we're going to kind of look at what's happening now and what kind of new things we see out there. And then again, at the end, we'll hopefully have some time for questions and a recap. Okay, so we're all in this together. I didn't want to use that term. I said I wasn't going to, but think of it as all of us technicians are in this together, right? This has affected us. It's affected the way that we practice on a daily basis. We know not all of you as technicians are in a general practice or an emergency room or in a hospital. You could be in academia. You know, you could be in industry.
Yeah.
Yeah. So everything may, you know, we're all experiencing this, but we might be experiencing it a little bit differently.
Our focus today will definitely be on a small animal, general practice emergency, the technicians working on the floor. But we hope that if you're outside of that, that at least you can still kind of look at what we're doing and incorporate some of those into your different types of practices.
Absolutely. And this picture is of Elaine's staff. And again, we were talking about, hey, this should be them getting ready for surgery, right?
That's where they write their medical notes.
Right. That's because last year that would have been pre-surgery, right? You just wouldn't have seen staff walking around wearing that, but that's what we're living through right now. So just wanted to kind of take us back for just a minute. This is the middle of June, towards the end of June, and things really, the timeline that we're living through is just, it's very compressed. So January 24th of this year, we were told that the risk was low, and that came from Dr. Fauci, and he told us that, hey, all of us Americans, you know, that thing happening overseas, we're very low risk, don't worry about it. So I went to WVC in February. I got to see the Kenyagi, his first time as president, and listened to the NAVTA membership meeting, and I had a great time at WVC because all that stuff was happening over there, you know.
Right, that wasn't going to affect us.
Not affecting us at all. Then this is Elaine and I, and in our role as for CARVTA, we were putting on a CE event, and that was just on March 6th. And we were advertising our CE event that was coming up in April, and really, you know, giving out pens and doing the usual CE stuff.
Going on with our lives.
Right. Then 1 week later, President Trump said, hey, this is a national emergency. January, don't worry, now we're in a national emergency, and, you know, things got real. So March 17th, the AVMA had to come out and say, hey, don't forget the veterinary profession. You're talking about shutting things down. Us in the veterinary industry, we are essential businesses. And this is social media posts that I had to put out for my practice to say, hey, we're essential, we're not closed. You know, don't think that you can't bring your pet in. We had a lot of worried clients. And if you haven't been on the AVMA website, I would encourage it. There's a lot of good resources out there, and they are representing us from a national level. We're going to talk about that local and state and nationally things might not necessarily be the same, but the AVMA has some great resources out there for you. So let me hit this here. Essential workers. So that was kind of where we started in March, trying to get us classified as essential workers. And Elaine, that picture on the left, Elaine had to actually put that out for her staff.
Yeah, I remember very early on there was a question, should vet hospitals be open? Should they not? You know, are we essential? I had a technician who went home after her shift at 2 a.m. She was actually pulled over for something else, and the cop questioned her, why are you out? What are you doing? You should be home. And so I had these little cards made for my staff so they could carry it around.
Yeah, and this picture on the right is the staff that actually, they had to divide up into teams. They're actually in the Philadelphia area. And that was, this picture is them just a couple weeks ago that came back together. We're going to talk about that team concept as well. But unfortunately, there were a lot of practices that closed. So they may have closed completely, they may have closed temporarily, or they may have just had to modify their hours. So when we were all trying to scramble and figure out what was going on, unfortunately, a lot of people faced, you know, a lot of uncertainty about having a job. So we all know cancellations started happening, and this was CARFTA's event that was going to be in April, and we had to put out our cancellation notice. You know, things were getting hot in California. We were all told to wash our hands and, you know, do the birthday song. And California, March 19th, put in, you know, California was right out at the forefront of this. And in some things, California is kind of over the top. But in this, they were very early on saying, hey, we now have a stay-at-home order, right? So eventually that trickled through the rest of the states, but March 19th was it for us in California. Okay, so what did we do, right? We've got to keep our practices open. We have to, you know, we went into this profession to work with pets. We don't want to have our livelihood affected. So recommendation early on was we've got to come up with some way of delivering our services in a new manner. So we called it concierge service or parking lot service or curbside. And what did that look like? Right? Or probably some of us are still doing it.
I remember how fast that occurred. I mean, one day we were trying to decide how to handle the clients and social distance. I don't even think we had that word. And then all of a sudden it was just, as an industry, we just shut our doors.
Yeah, we were talking about, well, we're not going to do handshakes, we're not going to have magazines, and then literally probably overnight we went to this curbside. So you can see there's a practice that's actually, I think, a veterinary teaching hospital. They put tents out. We have, you know, we have to designate our parking spots. And then of course there's the technicians going out to get pets. So curbside meant we're coming up with signage. We're saying, you know, that's the way that we have to do business at this time. And then we had to explain to clients how it worked, right? How do these curbside appointments work? And there was a lot of information that we're trying to put out in the midst of not only our own fear, but the client's fear. And we're going to talk about why we're doing what we're doing here. The practice to the right is a practice, and I'm going to show you those signs up close, but literally it's a 24/7 emergency critical care hospital, and they had to really explain to the clients how it worked. And so the picture on the left is a close-up of their sign. So not only did they have to say, stay in your car and call us, but explain the emergency process. Some pets will get taken in sooner because of, you know, triage. Please don't leave. That's an issue right now with the clients wanting to drop and go. Wear your PPE. And then the picture on the right is what now we're seeing in practice, right? Everybody with PPE doing their work. So we created this curbside service, and the reason for that was to stay out of the practice, right? We needed to keep a barrier between ourselves and potential clients that were contagious. We also wanted to keep the client safe as well. So we quickly went from this, which is kind of what Elaine and I were talking about, is we were developing these protocols in place. So first we thought we could keep people away from the front desk. And I even had chairs in front of my front desk. And we would have a few clients come in and actually try and move the chair, like, no, the chairs are there for a reason. And we went from that, and then we had to go to this really quickly. So this is Elaine's practice, and that's her front door.
That's my practice, and even though we had, you know, the doors were locked, people would still come right up to the doors, and my staff would come out and try to talk to them. They wouldn't back up, they wouldn't give them space, and then even we would have people waiting. Since they couldn't wait in the lobby, they would wait right out there on the patio, and they were just crowding. So I had to actually put up those crowd control barriers so my front team could maintain 6 feet. It was getting really crowded.
Right. So again, changing things are, you know, really quickly. And then we all lived through this. Some of it's still going on, but the hoarding and the, you know, panic buying. I still don't get the water thing. Somebody explained.
Or the toilet paper.
Right. Just doesn't make sense. And then, you know, the shelves on the far right, that could have been your practice. That happened to us. People were just panic buying dog food, like, and cat food. We were just, you know, things were just flying off the shelves, and much to our amazement. And then at a certain point, we realized, just like with the toilet paper, that we were going to have to limit the amounts that people were purchasing to make sure that everybody had their the appropriate food for their own pets. So all this happened to all of us, right? So again, we have to then put up the stop sign to have people come in. And I actually use this stop sign for my practice. This isn't my practice, but we based our stop sign off of this because people just would not read. They were so used to coming into the business and wouldn't actually stop, like, oh, anything on the door doesn't apply to me. So stop happened. So we have our concierge service or parking lot service because we want them to stay out of the practice. When this first started, I put out a notice to my staff that I had, you know, 3 things that were important to me, and it was to keep the staff safe, to keep our clients and patients safe, and then to keep the practice open so that we could take care of pets and keep our staff employed. And that really is what happened with most practices. But those were like my tenants, and I explained that to my staff, like, this is the priority. I need all of you safe. If a doctor goes out, if a doctor goes down with coronavirus, as horrible and tragic as that is, it has just a rebounding effect on no patients get care. You know, we can't take care of our patients. The staff doesn't have a job or a paycheck. So keeping the staff safe, and not just the doctors, but the technicians, they're so important. And if they go down, we don't have work. If the receptionist goes down and nobody answers the phone, we don't have work. So that really was priority number 1, keeping everybody safe. And that's where we start talking about the social distancing as well. So Nicole is a technician at Elaine's practice. And again, it's also the human-animal bond, right? We're all here. We get in this profession because we want to take care of those pets. And we're keeping Nicole safe so she can take care of Fluffy. I don't know that pretty kitty's name. But that's it. That's the human-animal bond, and we wanted to preserve that, and that's why we were classified as essential. So these pictures, the picture on the far left is one of Elaine's doctors, and they sent that picture to Elaine basically to say, this is how I'm coming into work tonight. And
okay.
You do that, you know, your N95 mask, yep, and your swimming goggles. I don't know what those are, but there was a lot of fear and a lot of panic. And of course, we all know that PPE was difficult to get. I love that the hospitals came up with a way around their PPE with their photos on their, you know, the outside of their gowns to show people who they were, those real people. And I don't know a lot of veterinary practices doing that because they don't have a lot of face-to-face, but it's really difficult with the amount of PPE that we had to use. So our next goal was keeping the clients and the patients safe. I want you to kind of look at the picture to the left, and I'm going to kind of go into that picture a little bit more. But this is a view from inside one of my colleagues' practices outside at the beginning of COVID. And if you can see through this picture right now, that's the way the client came. And if you look at the dog, we're going to look at, oh, here we go. There's the picture blown up. And that's a client outside of their window and their dog. And this is how the dog came into the practice. So here's the dog in its own PPE. And she shared this with us managers, and she's like, can you believe this? This is how we saw this patient.
Is it crazy or genius?
Is it right? Right. We really couldn't tell, because that really, to me, tells the story of the fear. Like, they were fearful for their pet. They wanted to bring it into the vet. They were fearful for themselves, but there was a lot of fear at the beginning. Not saying that the fear has gone away, but this is just early on. So yes, genius maybe. Okay, so then of course to keep the staff safe and our clients safe, we have to be cleaning, we have to do social distancing. We're talking about, stay home if you're sick, all of those things that, we've been hearing over time. But who's really taking on the role, right? So here's our technician over here. They're just wearing so many hats, right? They now have increased cleaning protocols. They've got to wear more PPE and deal with that, and still trying to do their job and just really juggling. So just amazingly enough, whoops, I'll go back here. There we go. That is the juggling technician, right? So it tells us how many things that we are doing on a daily basis, and now we're adding more things to them. Okay, so that was keeping clients and patients safe. Now we still have to stay open. So this is a picture of a screenshot of my hospital's website, and we had to stick on right up at the top, we are open for service. So many clients, even months later, think we shut down, right? They thought every business shut down. So we tried to do our best, and I know practices were out there trying to make sure their clients knew, don't put off, care. Like poor Elaine's emergency room, and she's going to talk about that. So slammed. So many emergency rooms had to stop seeing patients or put the kibosh on, non-life-threatening patients because they were just getting overwhelmed. And part of that was that some practices shut down or changed hours, but part of it was just that the clients just assumed that their doctor was probably closed, the veterinarian was closed as well. So we also got bombarded with national, state, and local ordinances, and a lot of them were in conflict with each other. So in California, we have our CVMA, and on the left-hand side of the screen, you can see they were giving us practice recommendations. Our Veterinary Medical Board was telling us how to practice in changing the way that we practice and our Practice Act with emergency regulations very frequently. On the right, the Veterinary Medical Board actually made some emergency changes to telemedicine restrictions and also our ability to refill prescriptions. So we're just getting bombarded with all this information in practice. The way we do business and the way we practice medicine is just changing hour to hour, minute to minute in some ways. So state of California, we were laughing, Elaine and I, that this is May 28th. Right. They actually put out some guidelines for
by May, we had already all figured it out.
Yeah, we figured it out. But again, they're telling us how to practice, and just kind of pointing out there, it's telling us, discuss history, exam findings, and recommendations via cell phone. Yeah, we got that. We've been doing that. But again, we're getting told how to practice. State of California, notwithstanding the Veterinary Medical Board, has never told veterinarians really how to practice. So all of this is new. So finally, what we're trying to do is keep our staff employed, right? Some people may have enjoyed a temporary holiday or a long vacation or staycation, but we all have bills to pay. It's our duty in management to make sure that our staff have a job and that the business is healthy and able to have long-term ability to keep people employed. So the closures were what we really wanted to avoid. And unfortunately, there's about 20% of the practices in our local area, the SCVMA, or Southern California Veterinary Medical Association, did a survey, and they've actually repeated the survey 3 times, and the results stay about the same, is that up to 20% of practices made significant changes to their operating hours, and about 5% closed. So that's a significant amount that can rebound and have effect to the other practices and to the patients that are being
Absolutely,
taken care of.
because they have to go somewhere.
They have to go somewhere, right? Okay, so keeping our staff employed. The hierarchy of controls is talking about how we can manage this unsafe thing, and our unsafe thing is coronavirus, right? So the most effective way is to eliminate it. And wouldn't it be nice? Elaine and I are
We can call coronavirus as manager, please.
Yes, yes, sorry. You there, let's get rid of that bad employee. So we can eliminate it, right? That's not going to happen for a while. But down at the very bottom of our triangle is our PPE. And the PPE is the least effective way to deal with this. So we're trying to move up from PPE to administrative controls and engineering controls and substituting. That's going to be, again, more difficult the higher up the triangle that you go. That is the area that, until we get rid of coronavirus, you know, we're relying on the things below it. So we're going to talk about that. Okay, so
this has been such a roller coaster.
Yeah.
I mean, back in January, February, we were fine, and you did a really good job taking us kind of through this timeline, this whirlwind that we've been going through. So what have the technicians been going through? So again, like we said at the beginning, the technicians that I'm most familiar with, and probably you too, are small animal, general practice, emergency. I've got my team here. You know, we attend a lot of conferences and keep in touch on social media with what's happening in our field. So, you know, what's happening with the technicians? What are the pain points that you guys are experiencing? So the biggest one overall, and I think from day one, has been you're just not sure. You just don't feel safe. And that fluctuates by day to day. Everyone was pretty scared at the very beginning, and then maybe we got a little complacent, and then now maybe cases are spiking. I can feel the fear again coming back. But you know, it's hard to be essential. We weren't sure at first whether we were essential, and then when it became solid that we were, you know, then some people were happy about it and some people weren't. It's not an easy job. We're right up there with firefighters and human nurses and food providers, you know, providing care for these animals. And think if we had shut down, what, you know, we want to be here because we want to be here for the pets, but that doesn't mean it's not easy. You know, and some of our colleagues got to go home, stay home. And so then there's a little bit of jealousy too. If you weren't an essential worker, I know for me, my husband was furloughed. My son is in high school. He was shut down. So they're both at home. You know, they're making messes of the house all day. And I'm putting in,
clean the bathroom.
I know, I'm putting in 10, 12 hours a day here, trying to keep things going. And, you know, it's not easy. And so I just want to let you know, the first thing, your feelings are for sure valid. Like, it's okay to feel a little bit jealous that other people get to stay home. It's okay to feel like maybe some days you wish you weren't so essential. That's valid. And in these times right now, just don't let it get overwhelming to you. So I don't know if a lot of practices out there, I'd like to take a poll right now to see, do any of your practices out there offer an employee assistance program? Maybe you could just add that into the chat box. I'd like to see who offers that. So my company, we offer an employee assistance program, and we mention it, you know, it's in the employee manual. We mention it in onboarding, and I have a poster in the bathroom reminding people, but I still find employees a year later that are like, employee what? So talk to your managers, see if this exists. So what it is it's just like a company-wide program that your employer pays for. And I know ours offers free counseling sessions, unlimited over the telephone or texting. If you want counseling sessions in person, you can get 3 in person for free. There's also financial services, legal services, things like that. So there's a lot of things. So you could check out and see if your practice offers an employee assistance program. Your health insurance also might have an option for you, but sometimes it's just a really good idea to be able to talk to a professional. We like to bounce ideas off of our coworkers and go home and talk and stuff, but really sometimes if it gets overwhelming, you can talk to a counselor, and that's really beneficial. Aside from that, there are some options of support groups that are online. I don't know if you're aware of Not One More Veterinary Support Staff, but there's a Facebook group, and it's for people in the veterinary industry who are not veterinarians. The veterinarians have their own group, and there's a lot of resources there. There are professionals that are involved in it, and then there's just regular people like you and me. And so you can get on there and you can talk about your troubles, and then people will comment back, and it's just a little bit of a support group. So you understand, people know that other people are going through the same thing you are. So I think that that's beneficial. There's also the suicide prevention hotline. I put that right there. Write that down. Don't let it get to that point. The veterinary industry has such a high rate of suicide. Just have that resource available. Don't let it get to that point. Don't feel like talking to a counselor is something you don't want to do until it's too late.
And it might not be you that has the issue, but it might be a coworker or somebody that you can offer that support.
Yeah, and you would have that resource to you. And I know there's also a text number. I don't have that up on the screen, but you can find that easily on Google. But you can just text them, because sometimes making a phone call is scary, but you can text them, and there's somebody can text you right back right away. So that might be a good resource for you if you weren't aware of that. And then just practicing self-care. I know it's a buzzword and it's kind of so now, but I mean, it's still legit, really. You got to take your breaks. You've got to. For me, I need time away. I like to go hiking in the hills, and that was pretty great because we're supposed to be isolated from each other.
Social distance.
Yeah, we could social distance, so I could do that until the hiking trails closed, and I was stuck inside of my puzzle. But just taking some time off. You can't work all of the time. You can't feel guilty. I know there's a lot of people that felt like when they weren't at work, they were guilty, and then when they were home, they were guilty because they weren't home. There's so much that we put on ourselves, and we really can just only do what we can do. But try to get some self-care. There's some meditation apps you can download that will take you through some peacefulness. Those are definitely options. For me, turning off social media and turning off the news occasionally was really the best thing. It just gets overwhelming, all of this information input, and sometimes you feel like the world is ending. But if you kind of turn it off and take a break and just kind of look around you, you're like, okay, like, all right, Leslie's fine. Everybody's fine around me, but family's okay. Like, just take a break. It's not all doom and gloom. So the other thing is really a great fear of, what will I do if I actually contract coronavirus? And some of you probably have already faced this, but for myself, I'm a planner. I got to have a plan in place. So that's what I would do. So I've advised my staff, like, what will you do if it happens? You can't just bury your head in the sand and not plan for that. At least have some idea. Who will take care of my kids? Where will I stay? Should I go to a hotel or alternate living arrangements? Things like that. It empowers you. So that way, when you get hit with the news and you're dealing with the emotions of the news, you've at least already thought about it. So I think that's helpful. And even if you can't make a whole plan of what to do exactly, just opening that conversation with your loved ones is a start. Have that, what should we do? What do you think we would do? Talk to your family and your kids and your coworkers. What would happen? Your managers. Another reason that technicians don't feel safe is maybe their coworkers aren't following the guidelines. Maybe everybody is supposed to be wearing masks, right? Kind of like us, right? We have our masks, but we actually work together quite a bit, so we've already been exposed. So, but anyway, maybe your manager or your hospital protocol says everyone's supposed to wear masks, and then maybe in the back the other techs are making you feel like, well, that's dumb. We don't have. That's just it's dumb. We don't have to do that. So that's really tough. In those cases, really, I would say focus on yourself. You can really only control yourself. So protect yourself. You wear the mask. You keep your 6-foot distance. If everyone's hanging out in the break room, sharing nachos, like, you don't have to participate in that. You can distance yourself. And it's kind of good too, because there might be other people who also want to wear PPE, but feel like others will make fun of them if they do. But if you're doing it, then that will make it easier for somebody else to do it. Be a leader. You can really only control what you can control. And obviously you would need to, if the staff isn't following guidelines, definitely take it to your manager, have that conversation. But while you wait for them to deal with it, you can focus on yourself. And if you are a supervisor and there are guidelines in place, be sure to enforce those guidelines. Okay, that's your job as a supervisor, is to enforce that. So don't think, oh, management's dumb, this is a protocol. That's why you're a supervisor. They put you in that position so you can take care of those things. Speaking of protocols, I don't know if you feel like this, but this is how I feel. Right. And I'm pretty sure this is how the staff feels, and probably the federal government feels this way too. It seems like every day we've got something new in place. This is definitely happening. I feel like every time I get something in writing, and I'll get the staff to sign it, and we'll train them all, and then the very next day there'll be something new. The very next day yeah. So just for that, just remember that practice manager, the people who are responsible for putting these protocols in place, are really struggling. Please just give your managers and practice owners some grace. If you're one of the ones out there struggling, you understand that we don't want the protocols to change every day. We don't want things to change either, but we're really just doing our best. And so we're just controlling what we can control. We're doing the best we can. And so my advice, if you're not in a supervisory position and you're tired of all the protocol changes, please just roll with it. Please. So pain point number 2. So aside from not feeling safe, a lot of you have a caseload that's changed. I'd like to put a poll out here. So who has had an increase in caseload and who has had a decrease in caseload?
Or maybe it stayed the same.
Yeah, or it stayed the same, or it doesn't apply to you. But Jamie, if you're there, could I have the results of the EAP? Do many practices have an EAP?
They do, and one of the really interesting, agreed, I love EAP. One of the really awesome ones was that somebody had their EAP through their pet crematorium service, and that is a resource I've never considered, but what a great place to reach out and see if they offer that, because they may be a bigger facility than your small practice.
Right. That's good. Utilizing the resources if you're a smaller practice.
Yeah, absolutely.
Good. I'm really glad to hear. I feel like the industry as a whole is shifting towards offering mental health support for the staff, and I'm glad to see that.
Agreed. So it looks like a significant portion of people are seeing very large increases.
Right. That is our experience as well.
Yeah.
We're going to talk first just about those techs who have a decreased caseload. So you might work for a surgical practice or in a surgery department, and they're not doing elective things, or they're putting off hip replacements and knee repairs and things like that that they weren't before. So I guess my advice to you would be, try to make yourself useful to your hospital in other ways. This is the time to reorganize that surgery suite that you wanted to make it deep clean things, get ready for your AHA inspection, be ready for things like that. In my emergency room, we have also experienced a high caseload, but what's happening is that the front staff has become quite inefficient. With the curbside, it's taking forever. And so what we find is in the back, where the technicians find themselves kind of standing around waiting for the orders to come back. So in our hospital, what we've done is we've tried to make them useful as well by cross-training them to the front. So we brought in the technicians, we taught them, like, this is how you enter a chart. This is how, into the computer system. This is how you make meds. You can get clients on the phone for the doctor. There's lots of ways that you can be helpful. So if you're in one of those practices where the front is just dying and you're in the back going, hurry up, I need my orders, maybe that's a way that you can help out. Another way, this is just a shameless plug for myself. We need more people at the emergency room. So if you're in one of those practices where you've been furloughed, or you're not picking up as many shifts, apply at the local emergency clinic. I'm almost guaranteed that we need you. We need you. Yes, right. We actually have a summer student program. I usually run it from Memorial Day to Labor Day. They come in just zero experience. They're usually tech students, and they start just doing laundry in cages and things like that, learning restraint. And then by the end, they're pretty good. And we hire some of them. I had to start that program early. And I didn't just use students. I brought in some staff from other hospitals where they'd been furloughed. So it was useful for us. But if you are like the rest of us, your caseload has probably increased. I know for me, for the emergency room, we've seen a 40% increase in cases over the last 3 months. And it's overwhelming. We're running out of cages. We're running out of phone lines. We don't have enough staff. Our parking lot looks like this every night, obviously dark. So there's a lot of trouble with it, a lot of problems with this, right? I mean, what are you going to do? It can feel overwhelming to you. If you're trying to treat all of these cases, how can you get to everybody? So my advice to you is really just try to focus on the patient or client that's in front of you right there. That doesn't mean, go visit with the client about, last summer's trip. It just means that if you're thinking about 10 other things, you're maybe not going to do a good job on what's in front of you. Focus on the one that's in front of you, do a really good job on that one, and finish it start to finish. Because if you only do it halfway and then you do something else halfway, then you've got to go back, and it's really inefficient. So that's really just find more ways to become efficient. If you get some treatment orders, don't get the animal out or have your assistant get an animal out until you're ready. Like, have all the drugs drawn up, have, know what you're going to do, like, get the blood drawn, hand it off to somebody, they can start running the blood, and you can start doing the treatments, go get x-rays. Like, try to get it all done at once as efficient as possible. That way you don't have to go back to that patient. Or if you have something that's going to take a long time, like maybe you need to run some blood work or something, get the blood, get it running, then go do the next thing, and then come back to it. So, definitely don't sit there and wait for the blood to get the results and then go on to the next one. So just try to be more efficient. I think techs as a rule, as a whole, are pretty good at that, trying to multitask, but also
you really
be
have
efficient.
to be good right now.
Right, definitely. And then again, I know your caseload is increased, but really just honestly take your breaks. Your patients need you to be okay.
You got to refuel.
You have to refuel. If you're hungry, if you haven't used the restroom in 7 hours, if you haven't sat down, your feet are hurting, you're not going to be as good. Okay. So you really need to take those breaks, and it's hard, right? Maybe the practice is in a state that doesn't allow that, or doesn't just require it. We require it. But I know my staff, they're getting short lunches. Sometimes they're not getting lunches, but I want, unless the animal in front of you is dying or is going to die, is very critical, take your break. Take your break. I know the limping dog can wait. It just can. So that's my advice. Yes. Yep. The last pain point I'm going to talk about is really just kind of a multitude of ways that you can't provide the care that you're used to caring for. Used to caring for clients, and you're used to caring for patients in a certain way, and you just can't do that anymore. This first one here is definitely more of a general practice type thing. But yes, but that was. Tell me again about the survey. That was.
Yeah, so our SCVMA, our local Veterinary Medical Association, is doing a survey every month, and they keep asking the same question, and is, what do you miss most from now, currently, from before coronavirus started? And every month it comes back that hugging my clients is the thing that they miss most. Because the client that we've had, you've known since they brought in the kitten or the puppy, through adulthood, through geriatric, to that final moment with them, you just want to hug them. And I'm just kind of getting the goosebumps, because it's so difficult not to give them that compassion through a hug. And although in emergency, you're generally meeting them for the first time when that happens, it's still, euthanasia is probably the hardest one. And even if it's just, somebody that you've seen, you've just known them for a long time, that we're missing out on that.
And that can be difficult.
Very difficult.
I'm not a hugger, so this isn't a big thing for me, but, in emergency medicine, we're kind of like, let's go. But the euthanasias have definitely hit the hardest, especially because we're not allowing clients in. So we're in-room euthanasia, so they have to say their goodbyes out in the parking lot, and it's crushing. So in those cases, you still have to protect yourself, but maybe you can find new ways to express your compassion. You can use your words. You can say, this is where I would really want to hug you, but you can put your hands on your heart and just tell them in words. I know here we're using cell phones a lot more because we were running out of landlines. And with that has been a new opportunity. We can actually FaceTime with the client. So we can FaceTime for euthanasias, and they're so appreciative of that. There's other ways you can, you can cut locks of fur for them and keep it, or you can get a little stamp pad and give them a paw print. At least it's some memento, just a different way of expressing your compassion, because that's all we're trying to do, is just show the owner how much we care. The second thing is really is the pet, right? I know my staff, and I did too when I was on the floor, is I really took a lot of pride in how I cared for each patient. My cats did not just sit on a bear cage. I didn't just put the cat in the cage and go. Like, they had a litter box, and they had a nice little bed, and we'd roll up little towels and put it right, and maybe somewhere to hide, and make sure that they were comfortable, not just there, not just basic, but comfortable. And honestly, with this caseload, there's just not a lot of time for the extras. In general practice, you might want to have enrichment and toys and things like that. There's just no time for that. So, I mean, but really maintain your minimum standards of care. This goes back to just focus on the patient in front of you. Don't put that cat in there with no litter box, no water. Don't do that. At least maintain your minimum standards of care. It may not have enrichment. It may not get cute little folded towels, but this is only temporary. Really just remind yourself this is temporary. You're still doing your job, and that next patient needs you. And then this is a big one. And honestly, I put this in here. I'm no expert by any means on compassion fatigue. This is something that's really come about recently, that we've come to light, that people in the caring professions, they take it all into themselves. Okay. And so, that's why they have such a high rate of suicide in these types of caring professions. A veterinary profession is one of them. You're tired, you're overwhelmed, and that next patient comes in, and you just can't care anymore. You just can't be one more patient, and you get to that point. And so when you get to that point, really, I think it'd be a really good idea to just seek professional help if necessary. There's all kinds of little things I could tips and tricks, but there's a tipping point where when a bad day becomes a bad week, becomes a bad life, and you really need some professional help. So just remember that there's resources out there. Again, self-care is going to hopefully help you prevent to getting to that point. They've got that little battery there. Really, like, you need to recharge.
Okay, so we've kind of lived through our coronavirus experience. We're talking about what is hurting us, and now really kind of the need is, what solutions can we do just to improve our day-to-day operations? Where do we see things going? And, we're all starting to see the additional safety changes. We're talking about the different levels of reopening. In some areas, the reopening's happening, and others it's scaling back. But you're going to see continued emphasis on safety.
So, like, my practice opened the lobby a little bit, and then the cases started soaring of coronavirus, so we're going to close back up.
Right. And a lot of that's probably going to happen. Again, those protocols changing.
Another new protocol.
Another protocol. So the top picture is Starbucks, probably overseas, but I don't see us using our temperature guns on our clients, but we're probably seeing temperature guns on the staff. And there's a lot of practices that are doing daily temperature assessments. You have to take a general intake quiz, how are you feeling? Have you been exposed? That kind of thing. The picture on the bottom is a practice that's gone to totally contactless transfer of patients, and I have some safety concerns with that, with escaping, but you know what?
Absolutely.
There may be,
even from the cars.
Yeah,
is probably
right. The whole process has added safety levels, but contactless passing of the pets may be what we're looking at. So this is some pictures from Elaine's practice, and a lot of this happened over Memorial Day, where they knew they were going to have such a high caseload that they actually created this outdoor area for them, socially distanced, with telling them again, we want to welcome you back, but we're not quite ready to do that.
We had to add the porta potty. I mean, because Memorial Day, they're waiting 2-3 hours in the emergency room, and it's going to be hot, and you can't idle your car that long. this has been really frustrating.
Right. And she had to put that 15-minute, limit on that drop-off area right in front of the practice because people just wanted to camp out and kind of have a social hour in front of their practice.
They were tailgating in front of our door.
Okay, so this is just a little humor here, but it is a thought to think about. Thanks for choosing VCA. Your receipt and dog are in the bag. Stay safe out there, wink, wink. But
it's kind of been a funny joke for years and years that we wish we had a drive-through, and we almost kind of do now.
Right. It's, drive-through medicine, drive-through pickup. Could it be the drive-through pet transfer? We don't know. But structurally, a lot of our practices are changing the way that we do business. This is some more pictures of Elaine's practice that she's done some great things with having to create that safe environment. The bigger picture on the left is actually an exam room with a clear curtain to separate the client on one side and the doctor and the technician and the pet on the other side. And so I think we're going to see a lot of these physical barriers, and it's a great idea that when they get back in the exam room, she's going to try. And then the top picture is her lobby where they physically had to remove a cushion to space out so that the clients weren't sitting next to each other and we're having that social distancing. And the bottom, as you've seen a lot of practices implementing the sneeze or the cough guards at the front desk, and of course the PPE. These are some things that kind of came up in a webinar that I watched recently from a veterinary architect about utilizing your outdoor spaces and repurposing them. The top picture is San Clemente Veterinary Hospital near me and down in South Orange County. And they actually have a rooftop area that was for, they used it for their clients for like dog training and for the staff during the day. But actually they're suggesting that we do some exams outdoors, and this is kind of a safe area that they could potentially do that. The bottom picture is another local practice to us, that's their Serenity Garden, and they're talking about utilizing these outdoor spaces for more of a safe outside area. So you might want to think about if your practices have patios and other areas, like what's the new normal? Where are we going to be doing exams and treatments? So we've got the safety changes, the structural changes, but it's just the support within your practices. And you don't need to wait for your management to give you that support. You can organize potlucks and other ways of just thanking your coworkers. The picture on the left is a practice that really went all out to thank their staff for, going through this process, and, really, obviously we're very appreciative. And then the down at the bottom right, and this is an actual what that is Elaine made these wonderful pins for her staff, and it's Veterinary Hero. I was an essential worker during COVID-19 pandemic 2020. They're still there. I think I was holding it upside down, but it's such a nice thing, and they all got this with a little bonus. And
I think we've all tried to, there's a lot of reports came out with Amazon was increasing, everybody's pay, and people were getting hazard pay and things like that. And, our clinics, we're not Amazon size. So we want to do something for our staff, but we obviously can't, do anything on the size of Amazon. So our hospital chose to give a mid-year bonus. It matched what they got for a Christmas bonus. And then we added the little pin, because not only do we want to compensate them financially, but we also just want to say thank you. Like people really want to be appreciated. They want both. And your hospital did some special things too.
Yeah, and I know a lot of hospitals are doing what they can, but it's just that support. So if you feel supported, you're going to have an easier time of this. So my practice, it's my break room on the left with some of my staff, and we've had a lot of vendors contribute. We've done weekly lunches, and we're also playing we did Corona Curbside for 1 week, and then the staff loved it so much because it was so fun that we do it every Friday now with some just fun games. So food and fun help, and you can be part of that. And then of course there's the community of people out there. Some of us are on Zoom overload, but introverts may like that.
Well, it's preferred to in-person meetings.
Yes. But just knowing that there's a community of people out there to support you.
You're not isolated.
You're not isolated. And this was a wonderful thing that was put out by Veterinary Growth Partners, and restating Mr. Rogers' quote about us as the helpers, and we truly are the helpers. And it's just something to know that the community supports what we're doing. And when you have that support, that tap on the back, I think that makes us feel better. We actually turn this into posters all throughout the hospital. And my staff just say that they'll read that and it just gives them a little boost. So we also know that the kindness to the vet community, there's a lot of people being very kind and supporting us, but we have had some unkind things happening.
People are very angry right now, but they're not angry at us. They're angry at the situation. They're angry at the government, but the government's not standing in front of them. Our staff is. So it's been tough. My staff has really had a hard time.
Yeah, so Elaine made this wonderful,
the one on the left.
The one on the left, and it was, you know, please be patient and kind to our team. And the part that I loved was the fact that it says, we don't want to conduct business like this, people.
We don't want to do it either.
This is just what we have to do to get through the process. And the middle one is, I found that on, a team shared that on Facebook, and I love it. And again, they're just wanting their clients and the community to know, hey, just be kind, stay positive. And then this one came out on Facebook just a few days ago, and it was, I think we're all kind of facing some backlash from clients that, you know, please be respectful. So I'm a Trekkie, and if you don't know, in Star Trek, anybody that wears that red uniform has a very short lifespan. They're done. They're going off to the away mission and they're not coming back. So we still have challenges ahead. We are not through this by any means. This is not, our webinar is not going to solve coronavirus. So we do have to be aware that we're getting people going through, trying to get back to normal, but we're going to still have these challenges for a while. So there is a vaccine timeline, and this was put out by Dr. Fauci. And, you know, if you look at the end of the timeline, it's January to April 2021, right?
That's exhausting to even think about.
10 months, you know, 12 months. It's a long time. And just remember that before 2020, none of us had heard of social distancing. We hadn't heard about flattening the curve or even what COVID-19 was, or super spreaders. So we've had all of this happen in a very short period of time. That vaccine is going to come sooner rather than later, but it is a little frustrating for us right now. There we go. Hey, we made it through the end. And there's so much more that we want to say. We wanted to make sure that all of the technicians out there realize that
we're all going through it together.
Yeah.
We're all doing the same thing. We hope that maybe some of these things that we've shown you that other hospitals are doing and that we're going through might be helpful and useful to you and your practices.
Right. So thank you. Our emails are on there. We'd welcome any feedback from you, and feel free to reach out to us. Jamie, I know we were kind of up at the end of the hour there. Did we have any pressing questions that we could answer?
We don't have anything that's hanging out right now,
Okay.
but I just reminded everybody that if they've got questions, that they can put those into the chat. I really appreciate you guys. Anyone who needs to go, you are welcome to do so. We want to respect your time. We want to thank NAVTA so much for sponsoring this webinar. These webinars are usually part of the NAVTA membership benefit. You can find out more about other member benefits by visiting navta.net. So please do that. And again, thank you guys so much. And if anybody's got questions, we're going to be here for a few more minutes. So you guys are welcome to drop those questions. And Tina, yes, I believe that this will be available to view later. There will be more information available from NAVTA on that coming up. And we'll get your certificates out to you guys. Again, it is not a race approved CE, but you will get a certificate for having attended, and just for the live webinar portion. So thank you guys so much for being here.
Great. Thank you. Thank you for having us.
Thank you guys so much.
Yeah,
Good luck out there.
Yeah,
absolutely. Maureen mentioned that it helps us, helps her to reframe things by saying physical distance rather and distantly socializing.
I like it.
Yes.
Yeah,
Yes.
I agree with that completely.
Yeah, we have a lot of colleagues, managers, and we kind of hang out together. And now we were quarantined, so then we started doing what did Melissa call them at night? I don't know, but essentially we all got on Zoom and drank wine.
Yes.
Yes. So that was fun at first.
Yep, finding those ways to be socially connected is really important. So I want to thank you guys again. We really appreciate it. NAVTA, thank you guys so much for being here for us. We appreciate you as well. And we are going to go ahead and have a good evening. Thank you so much, ladies.
Thank you.
Good night.
I'll let you do it.